voice may be having different character. Now the character is inaudible. It may be vocal fatigue. It may be a double voice. It may be a nasal voice. Or high-pitched voice. Or breathy voice. Then only there comes child voice and female voice. Anyway, that will prevent their highness. A manly voice is not there. That is a puberphonic voice. So, the amount of puberphonia in the society is great. That can be easily treated. That is the thing I want to tell the people. It is not a disease. It is not to be afraid. So I told you, deviance, that means the society doesn't accept your high-pitched voice for a male. It creates a dysfunction. A strong emotional character will be created. Distress. That include anxiety, stress, just like post-traumatic stress disorder. Very great thing. Post-traumatic stress disorder is a great panic thing. It is just like a bad instance happened for a lady. Then result in severe depression. So the clinical depression will be more severe. But overall, my finding is, if you are able to accept with confidence, control, commitment, and challenge, it is not a disease. But that doesn't happen with everyone. Try to understand, it is not a false voice. It is not a mutation. It is just your childhood voice continue. But the voice may be raspy, voice may be low pitch, voice may be different. It can be mutated because you want to get the manly voice by yourself, how it is possible. So, number one, try to understand it is not a disease. It is just a continuation of your child voice. Then everybody says the structure and function of the vocal tract, including vocal cord, is normal. So our feeling is there's no necessary to change the anatomy of the larynx to treat puberphonia. But there are good surgeries are there. They change the anatomy and they get normal voice. How it is possible? That is why we are bringing the theory of redirecting phonation. The phonation is redirected from the larynx to the pharynx. That is called voice break. Yes, female children, child below 12 years, both male and female are having laryngeal voice as a predominant factor. That continue in ladies, and in male, voice break happen. Voice break means it is a transmission from laryngeal voice to pharyngeal voice. Pharyngeal structure is in such a manner it produces low pitch voice. Along with that, nasal phonation will be good, make it more strong, and you will act as a cushion. It is a good vibrating mechanism and won't get tired like vocal cord at all. What more you want? You are having a good voice, male low pitch voice. You can talk hours together, nothing will happen. You are a great person. So, this is the essence of voice break. I hope it is easily you are able to understand. The voice break, number one, what is puberphonia is not a new voice at all. So, that is what we are telling. No speech therapy is required. Only speech training is required. So that is what I'm going on insisting. No speech therapy is required. Speech training is required. Because you are not going to change the voice. Voice is not broken. It is not transformed from lower end of the supravocal tract to the higher end of the supravocal tract, from larynx to pharynx. So that is we are calling as a pharyngeal voice is low pitch voice because the structure is like that. The structure needed for low voice, the anatomy needed for low voice, that is up for a male. What is available there? That is pharyngeal voice. So it is only a redirecting phonation from laryngeal to pharyngeal. But the beauty is, it is not a new glottis. Try to understand. Larynx is normal, larynx is there. By transforming the whole energy, the whole voice, not completely to the pharynx, because larynx is there in male. We are not removing. What is the fundamental frequency produced for the voice is by vocal cord, it is there. Only we change the resonance. Thereby, because of the modulation at the level of uvula, tongue, and nose, you are having low frequency. Thereby, we are able to treat it and they get their ancestor voice. So, this treatment is permanent, but it needs habituation. That we are doing it in 5 days' time. Luckily, all the patients who had come for treatment stay with us for 5 days and they do group therapy and they get a good success rate. Thanking you for this Saturday, 3rd May 2025. We have finished 1,562 cases of puberphonia. We hope to meet next Saturday, the same 5 to 5:30. Thanking you. Great, happy, 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 happy.